The main idea of these scenarios is for her to feeling like trust. She should feel like she can trust you, she feel comfortable to be with you in the room, like with her midwife. You care for her, you listen to her, and you ask for her concerns. So you know what you are doing, you know how to do the abdominal palpation, you know how to check her fundal height, you know how to check her baby. Also, you need to know how to document, because the documentation is really important to her as well. So you give her the advice of what she should have with each gestation. Safe baby bundle is really important in Australia. There are 5 main things that you need to focus. Hello everyone, welcome back again to my channel. You are with me again, Julia. It's been such a long time that I haven't filmed any videos because I was on a holiday for almost 2 months visiting my families and friends, and now I am back. If you watch my video for the first time, welcome to my channel. I'm Julia, an overseas qualified midwife that migrated to Australia through the OBA pathway. And after a long journey that I have been through to get AHPRA registration, I decided to create this channel to share with you all about my experience and how to become a midwife in Australia. So if you are interested and you need to go through this process like me, stay tuned. This video will be a part of the Midwifery OSCE Preparation Checklists, so feel free to check out in my channel as well. Just so you know, I have signed a confidentiality agreement when I did my OSCE, and it said, I agree to not disclose or discuss with any person any information related to the examination. Therefore, this series of OSCE preparation videos will be based on my midwifery practice in Australia as a registered midwife, and I cannot discuss any content or information regarding my experience in the OSCE exam. Let's start with abdominal palpation today. So, assume that you are working in the clinic as a midwife and you need to see the women who come in for the antenatal visit. So, before you're gonna see her, there's some information about her that you would like to know. For example, her name, her date of birth, her gravida or para, and also her gestation, her due date as well. And once you're ready, you might go see her. Okay, so once you're ready, you ask her from the waiting area to come inside the room, and then you wash your hand, introduce yourself. Hi, I'm Julia, I'm a midwife in the clinic today. Can you confirm me your full name and date of birth, please? So she'll tell you your full name, her date of birth, and maybe you can ask her, do you have any allergy? Do you have any medical history? Any complication in this pregnancy? If she say no, that's good. And then you might ask for her pregnancy record, because she needs to have her pregnancy record with her every visit. So you check on that, check her records and confirm how many week gestation are you today. She might say it's 30 weeks or it's 37 weeks today, and then you make sure that the information is correct. And then also you can ask how is she feeling today, and she might say everything is good, there's nothing concerned. So you can continue your questions. Is baby moving okay? She might say yes, baby moving well, just move in the morning. Do you have any contraction? Do you have any fluid loss? Any bleeding per vagina? If it's a yes, you might need to go further, but if she say no, that's good. And you can ask her, is there any issue like headache, blurred vision, or epigastric pain, to confirm that she doesn't have any signs of preeclampsia. And yeah, and then we're gonna go straight. So after you talk to her, go through the questions and make sure that she's feeling like she's listened, like you are listening to her, and the communication and the relationship between you and her is make her feel like she trusts you. Okay, and after that we're gonna ask her to get on the bed. So make sure that maybe you can ask her, have you scaled your weight today? Normally she'll say no, so I will scale all of her, like check her weight every time that she comes for the antenatal visit. So check her weight, check her blood pressure as well. Normally we use the manual one in the clinic, and ask if she would like to empty her bladder before get on the bed, because we need to do some abdominal palpation. So before you perform the abdominal palpation, you need to tell her of what you are going to do with her. So if she already emptied her bladder, she happy to get on the bed. So normally we put her in like upright position, so she don't like lie flat on the bed because it's really uncomfortable for pregnant women. So put her in the upright position and tell her that, okay, today I'm going to do the abdominal palpation and I would like to check your fundal height, see how high is the uterus growing, and that can check about the baby growth as well. Also, we're gonna measure the fundal height with the tape, so we know the centimeter, and then we're gonna palpate for your baby to see where is the baby's back, and also I'm gonna feel the presenting part as well, see if it's at the head or is it the bottom, and see if it's engagement already or not. And after that, I will listen to the baby's heart rate for 1 full minute. Is that okay for you? If she say yeah, that's okay, and then you can proceed. So you start with feeling. So I normally use the Leopold's maneuver. So Leopold maneuver is like there are 4 grips that you normally perform. So the first one is the fundal grip to check the height of fundus, and then you measuring with the tape as well. So the tape will measure from the pubic bone to the top of the fundus, and then you see in centimeter. Second grips is the to see the baby's back, lateral grips. So you check for the baby's back if baby is lying on the left side of mother or the right side of mother. And then the third one is you check for the presenting part. So the presenting part can be cephalic, can be bridge, or can be a compound, something else, as well as you already know. So normally if it's cephalic, so you're gonna feel that it's firm, it's like a bone over there on there around pubic area. And also you also check for the engagement by the third and the fourth grips. Okay, so you can check for the engagement and you can tell how the baby's presenting part is descend into the pelvic brim. And in Australia, they will divide it into 5 levels. Okay, and you can confirm with the fourth position to see if it's like engaged or not. Okay, and after you feel her belly and you're happy with the result that you got it, and then you listen to the baby's heart rate for 1 full minute. Okay, normally in the clinic I use the Doppler, so the Doppler you can hear it and the mother can hear it as well. Alright, you listen to for 1 full minute, and after that you tell her the results. So you tell her the result about everything that you palpate. So you tell her about the higher fundus, is it accurate, like if is it related to the baby's growth, to her gestation. You tell her about the baby's back, is it baby is lying on her left side or baby back is on her right side. And then you tell her that what is the presenting part that you can feel. It can be baby's head down, and you can tell her if baby's head is engaged in the pelvic or not, and what does it mean. Okay, and also the baby's heart rate, is it normal? If you get like in Australia it's 110 to 160 that we say it's a normal range. So yeah, you tell her what you found. Alright, and after you finish telling her about the result, ask her as well, do you have any questions? If she say no, everything is good, is my baby doing okay, is everything alright, and you can tell her if everything is alright or is there any concern that you can think of. Okay, and after you answer her, you need to spend some time on the documentation as well, because every pregnancy visit you need to document in her records. Okay, and the record will look like this. So this is a sample that you can get from AHPRA website. So as you can see, there will be a names and her information at the top right, and there will be a gravida, para, and then for today you need to put your date and time of this visit, her blood pressure if you check it, and her week gestation today, her fundal height, presenting part, cephalic, bridge. You can put baby's back at right or back at left as well. How is the descent? 0/5 to 5/5. Fetal heart rate, fetal movement, yes or no. Like, is there any fluid loss, yes or no? Weight, her weight today. Urine analysis if you ask her to do the US sample. And her next visit. So in Australia, between the first trimester to 28 weeks, we normally book for her to come in every 4 weeks. And after that, 28 weeks to 36 weeks, we're gonna book her in every 2 weeks. And after 36 weeks, we're gonna book her in every week. And if you have some time left after you finish the documentation, you can also talk to her about Safe Baby Bundle as well. So Safe Baby Bundle is really important in Australia. There are 5 main things that you need to focus on. So the first one is the quit smoking. Second one is the growing matters, which means she need to come to the antenatal visit for each booking. And side sleeping after 28 weeks. Movements matter, so she needs to monitor the baby's movement. If she has any concern, feel free to come back to the hospital. And also talk about the timing of birth as well. So if you see a woman that almost let's say after 37 weeks, you might talk to her about signs or symptoms to come back to the hospital. If she feel like she have contraction every 10 minutes, if she have water broke, if she have PV blood loss, if she have any concern about like PET symptoms like headache, blurred vision, epigastric pain, she should come back to the hospital. Reduce fetal movement to come back to the hospital as well. Or is there any other concern? Where can she contact? Like you need to give her the number that she can contact. It should be 24/7. Or where should she go? Like emergency or the maternal assessment unit, something like that. Okay, alright, I think that's it about this scenario. So don't stress if you haven't worked in the clinic for a long time, because I barely work in the clinic as well after I graduated. So don't stress, take your time to keep practicing, practice, and you will get there too. I would say the main idea of these scenarios is for her to feeling like trust. So she should feel like she can trust you, she feel comfortable to be with you in the room, like with her midwife, and she should feel like you care for her, you listen to her, and you ask for her concerns. Also, you know what you are doing, you know how to do the abdominal palpation, you know how to check her fundal height, you know how to check her baby, you listen to her baby heart rate correctly, and also you need to know how to document, because the documentation is really important to her as well. Also, you give her the advice of what she should have with each gestation, and yeah, that's it. So yeah, so she can go home if she's happy. Alright, I think that's it. So thank you so much for watching, everyone. Feel free to comment your questions down below, or if you would like to add anything, if you have more experience than me, comment down below as well. And thank you so much for watching. Don't forget to give me a like and subscribe to my channel as well, and I will see you in the next video. Bye bye today.